Is it hard to convince patients to do implants because the rumor is that they're really expensive and they're painful?
Right. So they are expensive, obviously. I mean, they're one of the more expensive procedures in dentistry, but they're not painful for sure, and that is a misconception for all the patients. But once they talk to someone that has gone through implants or done implants in the family, friends, or if they look at our websites and see some of the testimonials of the patient, they do realize that that actually implant is minimally invasive and minimally discomfort afterwards. Very little post-op time to get back to to normal. So I think it's a matter of education, explaining to the patient realizing what they have to go through, and doing a little research, talking to someone that has had the implants, or looking up some testimonials or somewhere, which you can find it easily on the web, to understand, so it comes down to really understanding. And once you're understanding and you realize the benefits that it can produce for you, I think everyone understands what they're going to get.
Come on, it's surgery. You're putting a screw below the gums. That sounds
pretty good. The good thing is that the bone actually has no nerve, so it's like putting a screw in a concrete. Once the reason we want to numb the patient if there's a missing tooth, just for the gum that's covering the bone. Once that gum tissue is numb, you don't have to numb the bone at all. Like I said, bone has no nerve endings in it. It's like a piece of concrete, so you could drill into concrete without any problem. It's the same issue. I think it's mainly mental. It's a lot of psyche and getting yourself psyched out. But like I said, we do implants and the patients barely take a pain medication the next day.
What are some of the ways that if I am nervous, what can I do to get comfortable for the procedure?
Right. So certainly there are different ways that we can make a patient more comfortable. There are oral medication that you can take prior to the surgery that calms your nerves down. There are anti-anxiety, sedative medications that works pretty good. You combine that with nitrous gas, which is a laughing gas, in the office. Now for those patients that are absolutely psychologically afraid, and they're usually, for anything in dentistry, those type of patients are afraid of, more advanced sedation, general anesthesia, and conscious sedation are definitely available. So we can make the patient comfortable at whatever mental psyche they have, whether by taking pills, doing full sedation.
Does that usually cost extra?
So the general anesthesia does cost extra because normally general dental or any dental clinician doesn't or not able to put patients to sleep completely. You have to have additional training of the dental anesthesiologist to be able to do that. So generally we would have to bring in an anesthesiologist into the office to put a patient completely under, and that cost for the anesthesiologist fee. So that would be the one that costs the most. However, if you use oral sedations, that's a minimal expense.
If you have dental insurance, it's just filling a prescription?
Yeah, pretty much, yes.
Okay, awesome.